second indicator researchers used was asthma or allergy increase due to temperature and pollen. Seasonal allergies and asthma have some common triggers and are both likely to result from a combination of environmental and genetic factors. Extremes in temperatures and humidity can affect people who live with allergies and asthma and can affect their quality of life and can fluctuate with the seasons. While allergies may be more seasonal, asthma prevalence can be a good indicator of community health year-round. Both asthma and allergies can impact quality of life and be an indicator of broader community environmental trends. You will see in the next few maps that Battle River Watershed and surrounding regions have an asthma prevalence rate that ranges between 10 to 14%. Asthma is a disease most often characterized by chronic airway inflammation. The symptoms may change over time, but rarely do patients become permanently symptom-free, so asthma usually requires lifelong management. According to Alberta Health Services, asthma is the most common chronic disease of childhood and the leading cause of hospitalization in children. The echo maps indicate that both males and females have an asthma prevalence rate between 10 to 14%, with the exception of the Wetaskiwin and County area. Wetaskiwin and County has a higher asthma prevalence rate than any other regions within the Battle River Watershed. The Central Health Zone of Alberta, where their study area is located, has an asthma prevalence rate similar to the province of Alberta. People across Canada and globally are affected by allergies, and for most, it's more of a discomfort rather than a serious condition. Seasonal allergies can potentially offer information about climate patterns and vegetation, and the prevalence and intensity can provide insights into trends in vegetation cover, changes in the pollen season, and seasonal weather changes. The maps researchers created show that the rate of recurrent sinusitis and allergy diagnosis in 2017 in the study area were generally below the provincial average and fall between 2.2 to 2.4%, with the exception of the southeast corner, which is slightly lower, and the northwest corner in the Wetaskiwin area, which is slightly higher. For males in the Battle River Watershed study area, the percentage is 1.8 to 2%, with the exception of the northwest corner, which is slightly higher. The map researchers created indicates females have a higher rate than males in the study area, and both male and female are lower than the provincial average. Measuring climate-related health impacts provides insight into the effectiveness of current public health and safety policies. With increasing frequency of extreme heat days, forest fires, and other weather conditions that impact air quality, more research is still needed to better understand how climate change impacts rural areas. Access to emergency and specialized medical care, high prevalence of outdoor and manual labor, demographic and socioeconomic considerations, including risks related to age, ethnicity, and poverty, should all be considered when looking at how climate-related health can impact rural communities. With more research and planning and initiatives and policies that support clean energy, communities may be able to address and manage some of the complex risks of heat-related illness and mitigate conditions such as asthma and allergies. Please like and follow for more information about our Health in the Watershed Atlas project.